Thank you everyone for inviting me as one of the speaker. And in our unit, we have a total bed of 24 beds in the pediatric cardiac intensive care unit, and it was covered by 2 consultant intensivists and with 106 staff nurse, which is 35 of them are senior staff nurse and another 76 is intermediate and junior nurses. Admission numbers to our unit are more than 1,000 patients per year. We have both cardiothoracic and cardiologic cases, but more to cardiothoracic patients. And from that, more than 80% of cardiothoracic patients went through open heart surgery, and the balance are closed heart. The case complexity is depend on the diagnosis and surgery, and I would say that most of open heart cases are complex and need special care. Okay, in order for nurses to join PTICU, there is no special requirement. It's similar to other units, which they have to complete basic nursing education with either diploma or degree in nursing and pass Malaysian Nursing Board examination. During the probation period for 6 to 9 months in the unit, they will be trained, specialized to congenital heart pediatric care with attached to nurse mentor and senior staff, guided by training log and followed by exam and competency scale assessment. After confirmed and able to perform well, they will continue work in our unit. And when they are about 3 years of service, they will be offered for post-basic training, either in-house post-basic training, that is a CCCN, and they also will allowed to join post-basic under Ministry of Health in general, neonatal, and pediatric nursing care. Beside that, we also have our own advanced training program to accommodate specifically to our patient needs, that is a CSNP and a CHD training program. For this program, they will go through assessment and interview before recruitment. This program will be offered to capable staff with post-basic certificate, and the aim is to train them to be resource of reference for working colleagues in enable to deliver continuous high quality and safe patient care. When talk about challenging, staff shortage due to high turnover is a worldwide issue. We appreciate the impact of a nursing shortage could be lead to increase of imbalance senior-junior ratio, increase medical error rates, and may cause the remaining staff experience burnout, dissatisfaction, and will lead to poor patient and caregiver experience in the hospital. Staff recruitment, one of the manpower shortage strategy, can help to certain extent, but doesn't balance up the senior or junior nurse ratio. In terms of retention strategy, we create a career development pathway by putting senior staff as specialized nurse. We are educating, setting up clear career path, and instituting coaching program to make them engaged and effective at work. Management also support to retention strategy by providing reimbursement for continuing education and certification program. Besides that, we also encourage the manager, the unit manager, staff and staff engagement activity, and establish culture of belonging in the unit. Manager actively participate in daily morning round, daily briefing and debriefing, and monthly meeting activity with all staff. In terms of promote work-life balance and reduce staff burnout, we encourage them to have outdoor group activity and having vacation time with other colleagues. Another challenging is lack of a specialized training for pediatric care. Previously, we don't have specialized training for pediatric cardiac nursing care. Thus, we're sending our nurses for CCCN, or which is more catered to adult patient, and general pediatric and neonate training under Ministry of Health. As such, we developed advanced training program to accommodate specifically to our own patient needs on pediatric cardiac care. And thank you to Children Handling for guidance and support in the training as they send the team to train our nurse in Malaysia. We are aware that staff training take a lot of time, effort, and patience, but it's well worth. With effective and established training program, we believe can improve retention and increase staff morale, thereby creating a positive, motivated, and competent workforce. This in turn will improve patient satisfaction and profitability if the practice is as well. Another challenge in what we're facing in the Malaysia in our unit is conflict management. As large and complex organization with multiple professional system, one of challenge is nurses often caught in workplace patient management conflict. Sometimes disagreement between multidisciplinary team will get nurses trapped in difficult situation for patient care decision. Environment where conflict are not handled will interfere with performance, motivation, and affect the quality of care. We are lucky we are received good hospital management support to solve the issue. The matter was openly addressed during meeting, and besides that, staff are also able to speak up any issue arising anonymously through online reporting. As to minimize conflict, currently we are practicing plenary combined morning round, which involving surgeon, cardiology, and nursing team. Management plan will be discussed, and patient care plan for the day will be carried out with mutual agreement. We found out that multidisciplinary participative method effective solution and can improve communication and prevent conflict management. Thank you very much.